The people talking about magic bullet medications, most of that is not borne out by objective research. So we have a disease that we don't have a clear pathway to treat effectively. It kills a lot of people, and in many cases it kills them despite everything that we would do historically for a virus of this, like a respiratory virus that made somebody sick, even the things that we would do for the flu in many cases. We're doing all those things plus more. They don't work. They die anyway. Sometimes after a long hospitalization, so we're talking about weeks sometimes in the hospital of fighting and ultimately dying, right, as a result. When you kind of look at that, you look at that structure, you say, okay, if we let this virus just run wild, let's just all be unvaccinated, the strain on the healthcare system will probably break it, right? And here you can argue at this point about, does the U.S. have the best healthcare system? A lot of people would say no, right? And then of course, there are people that would say that it does. They're statistically wrong, but they would say that. But if you take all those people and you let them all get sick, a classic example, so COVID, based on the past year, tends to break down in a couple of categories, right? One is you get sick, you have no symptoms or low symptoms, you're out for a couple of days, you go back to normal. Another percentage of the population is still relatively small, you just die, right? You die. Whether it's tomorrow or 3 weeks from now, you die and it's horrible and it's just, you suffocate and it's awful. It's awful to watch and I'm sure it's awful to experience as well. But speaking only from the perspective of those that have had to watch it happen, including myself, it is just a miserable, miserable illness. So then the middle ground are people that get sick and stay sick for a while. Well, I'll give you an example. So let's say the flu. People say it's just the flu. Well, the flu frequently would go like this. If you're going to die from the flu, you would get sick relatively quickly. We would know very quickly that you're doing really badly. And we would try to save you, and maybe we'd succeed, maybe we would fail, but it would be over fast, right? One way or the other, we would know which way this was going to break. In most cases, we would know quickly. With this thing, you can be 7 days, 8 days, 10 days, 14 days, 20 days into your symptoms and suddenly crash to the floor and die for a variety of different reasons, right? Not many of which are not preventable, at least based on our current knowledge, right? So now imagine you take a healthcare system, and this was what was happening in the winter. For example, when we had high case rates, we were seeing people that, let's say, were having an acute stroke, that we could not get to definitive care because there were no beds at all, anywhere, in multiple states, right? People having an acute heart attack, we can fix that. That's a thing we can fix, right? Except you can't fix them if they're in a place that doesn't have those resources, and if you can't get them to a place that has those resources because there are no beds available, then they could die or have an otherwise worse outcome than they could have, right? So it not only affects the COVID folks, they get stuck in there and some will live and some will die, but it also affects everybody else with every other kind of illness that you can have, right? Many of which are not infectious, right? And many of which we can do something about if we catch them early enough. So the point is that this thing produces an enormous strain. It's an overload, it's a strain on the system. So if we just allow it to go through the entire population, we will probably strain and or break the existing system.